Welcome to Workshop 2. I hope that you all really enjoyed DJ Rosa, which she's my tocaya, but that was a different Rosa's performance. That was really invigorating, especially after a busy morning with insightful remarks from our local level entities and electeds. This workshop is titled Overcoming Access Challenges to Mental Health Services. My name is Rosa Flores. My pronouns are she, her, hers, and I'm the Senior Programs Manager with the Latino Coalition for a Healthy California. I currently find myself in Nisenan land in Sacramento, but I also love to share that I am originally from Southern California, from Kumeyaay territory in San Diego. And I'm really excited to introduce our speakers for today. Our first panelist is Michelle Mas, and Michelle is an enrolled member of the Red Cliff Band of Lake Superior Chippewa Indians of the Gray Ojibwe Nation and Three Fires Confederacy. Michelle works as a licensed clinical social worker in San Francisco, California, at the Native American Health Center. She has extensive experience in providing psychotherapy and early intervention prevention counseling to individuals within the Native American Alaska Native community. Welcome, Michelle.
Thank you.
And we also have, I'll hand it over to you in a second. And we also have with us Danielle Munoz. Danielle is a Chicana from El Paso, Texas. Growing up in a military family, she spent much of her youth in Southern California. Danielle is a licensed marriage and family therapist and has worked in hospital, community clinic, and university settings for over 12 years. She currently works in higher education and founded the Basic Needs and Crisis Resource Center at Sacramento State University. Thank you for being here today. And I'm going to start us off with the first question, which is, tell us if you'd like to expand a little bit more about who you are and your work to increase accessibility in finding culturally competent healers. And I'll hand it over to Michelle.
Great. Good morning, everybody. And thank you for the excellent introduction. I'm happy to be here today. I work as a licensed clinical therapist at the Native American Health Center up in San Francisco. And because I'm a transplant here, even though I was born here. This is not my indigenous land, but this is the land of the Ohlone people here in San Francisco. So I'd like to acknowledge the land that we are on today, even although we're virtual, we're still on the land. I've been working in behavioral health for probably about 21 years now. And, I've worked in several different aspects as a clinician and as a therapist. And some of the work that we've done and that I've done and been a part of is bringing traditional healers into our agency to meet with clients. And in my own work in working with community in a clinical setting, I've incorporated different traditional methods into therapy. And so I'm hoping to get a little bit more time. We'll talk about that later, but I just want to mention that in doing that, there is a way that we can do that, because when we do traditional services, we just need to know how to translate that into what it does. What's the purpose? What does the traditional service do? And how can we translate that into evidence-based practice? And so that's part of the work that I've done. I just don't want to go over my time.
You're fine, Michelle. Thank you so much. Danielle, tell us a little bit more about what you do and how you're working to ensure folks have access to culturally competent healers.
Great, thank you. So yeah, my name is Danielle Munoz, and my pronouns are she, her, ella. And most of my work started with grassroots and really spending time with people and communities. And then as I was able to take more positions that were more systemic, like like I said, now I founded the Basic Needs and Crisis Center at Sac State, and I'm the director here. So just kind of elevating voices and translating them into programs, funding, grants, of, really trying to represent what people need. And so really more of the pragmatics. It does mean I ruffle feathers in certain places, but that's what I'm here to do, because I am responsible to the people I serve. And then I kind of went off on my own. I have a full career, but I also on the side started a podcast called Nepal Queens. And that is where we unpack and demystify mental health issues for our Latinx community. And it's meant for folks to just sit around the table and listen. We do a plática style, and we just really talk and center what we, mental health from our perspective and what we need from therapists. So that's some of the work that I do right now. And I'm presenting from Sacramento. So I am wanting to honor the land of Nisenan, Maidu, Miwok, and Miwok.
Thank you so much to both of you. I love the contrast between what Michelle was saying around traditional healing and healers, and then Danielle introducing us to different ways to access that information through podcasts. So maybe a little bit alternative ways of receiving that information. So our next question is, and feel free to answer in any order you feel comfortable. But we'd like to know, what are 2 to 3 barriers that you have seen in your community that impact people of color's ability to accessing mental health services?
I'd like to go first. So one of the big barriers that we have is a lack of trust in our community. And this dates back through historical trauma, through interactions with the government and with systems of government. And these actions get transferred intergenerationally. So I'm sure everybody's familiar with the term historical trauma, but I'd like to add that some people use intergenerational trauma and historical trauma as the same thing. I like to use intergenerational trauma as the more micro of the two, and how it's affecting an individual and how that plays out today. So lack of trust from the boarding school times when people didn't have a voice, the children didn't have a voice. And some might think of, well, that was a long time ago. Well, last boarding school closed in the 70s, and that was not run by natives, and there was abuse going on all of that time. And so now we found the bodies of several children, and this has raised big triggers for people. People are really triggered by that, and they really need to be in a place where they can trust people. And so one of the areas about trusting that I talk about trusting is that we have to make places where people feel welcome. So from the time somebody walks in our doors, it should speak to them. The face that greets them, the tone, it's a welcoming space. Some of the things we've even done we've had a community drop-in center where we've had coffee. And those things work really well to start to bring community together with a staff person, somebody that's from the community, that's local from the community. And we can even do some prevention activities in that space. And the other thing I wanted to talk about is one of the barriers is funding for our communities. Oftentimes with Native Americans, when I look at statistical reports, I don't see a line including Native Americans. And this speaks volumes as to we are omitted. Again, the policies against us were exclusionary policies, or they might say for us, but these were exclusionary policies that set us aside from the colonizers that came in. And we haven't had much of a voice. And if our numbers aren't counted, when we are only 1.5% of a population and there's no reports, but the people are there. So it's important that people in positions that are talking to evaluators, fundings and evaluators, that they be sure to find a way to put the data about Native Americans. I had this happen one time when I was earlier in my career, when I was in management, and I noticed a report in San Francisco that it did not have Native American statistics in it. And so I got in touch with the evaluator, the head of the evaluation team, and I worked with him to figure out a way that we could have our numbers in there, because it was very important for us to get funding in the upcoming funding resources that were happening. So it did turn out that he found a way to put our numbers in there, and that helped us to get funding, grant funding. I'm going to stop there.
Thanks, Michelle. I agree with everything that you just said. So I would add on too that some of the barriers, I always look at it like there's macro level barriers and then there's micro level barriers, but especially in the Latinx community, I'm not going to speak for my community, but I do know, working with, and being in this community myself, that we have to address the failure of the mental health system for our community. So it is the actual active failure where we have been erased, we've been left out. When mental health and wellness started, of course, we have a lot of white male hetero theorists, right, that developed a lot of these trainings and evidence-based practices were a lot of white communities. And even when they did the ACEs study, the adverse childhood experience, that was Kaiser using, people with Kaiser insurance. So we have really been left out of the conversation. There has not been a lot of services in our languages. And also we don't acknowledge the immigration experience a lot of times. So we've just been failed by it. So that's definitely one barrier. Is why would we engage in something that's never served us all of a sudden overnight? And even if we did, would they offer in our language, in our budget? Is it easily accessible? If I have children, do I get childcare? So all of these things that are, that's why I think a lot of folks in the Latinx community, we do value wellness. I always want to clarify that. We absolutely do. It's in our bones. And we take care of each other and we pay attention to somatic symptoms, and we have dichos and we have family time and we have created our own ways of healing. They're just not in the traditional Western culture. So why do we engage? What's our buy-in? So I think that's one barrier, is we don't have a buy-in. And I think we're getting there, which we'll talk about in a little bit, but we're focusing on barriers right now. And then the other one is in navigating insurance. So if you are an immigrant here, a refugee, your country may have not had a healthcare network or system like we do. So there's going to be a learning curve. What is insurance? How does that work? Who do I have to call? How do I get on it? Does it cost me something? Who's going to help me in my language? And so if you're having issues with access to insurance, you're most certainly going to have barriers accessing mental health treatment. So we really need to demystify and make the insurance system available and again, make it welcoming. It's really a huge barrier right now for a lot of folks in our community. So there's also finances, and like what Michelle was saying, funding. So say we do have great proposals for programs and therapists who speak Spanish, or in any other languages beyond the Latinx community. So like, who's going to fund that? How can we offer that? Where's the infrastructure going to live? So we also need to think about those macro level. And then micro level barriers would just be that, we may have been left out of conversations about formal, like what I call like high level diagnoses. So bipolar disorder, schizophrenia, and those types of things, where there is an element where it could be hereditary or passed on, or I always like to say the environment, the genetics loads the gun, the environment pulls the trigger. So some of these things, even if you had, a good upbringing and loving parents, you might still develop a mental health disorder. Do we give enough information on that? So some people might be understanding or not understanding what is happening with their family member. But when we meet with them, it's clear that that person is experiencing hallucinations or bipolar disorder and things like that. And the families that I work with are usually like, what is that even? What is that? That's never something I heard in my country, or that's not something we talk about in my family. So a lot of times it's just even literally knowing what mental health is. It's beyond depression. There are actual severe mental health needs that people have that will require some medication and therapy, but how do we know that, right? We don't have access to that information a lot of times. So I think there's a lot of macro barriers and then some micro barriers, but I feel like that still leads to the macro of education and being included in these conversations early on. And the last part is a lot of our Latino folks, we don't get elevated financially in this society. Oftentimes we are not having gainful employment. We don't have insurance. So even if insurance is available, it's for people with, jobs that have benefits and things like that, which a lot of folks here may not have jobs that come with benefits. So I'll stop there as well, because we can talk about this all day, but I want to be mindful of the time.
Thank you so much. I keep nodding and, in agreement with a lot of what has been said. I really appreciate touching on the intersectionality between immigration and healthcare access. I think that's important. And the micro and macro level type of barriers. Our next question is around how we demystify mental health disorders. You kind of touched upon that a little bit, Danielle, and you also touched a little bit about stigma. Why do you, in your professional opinions, why do you feel stigma still exists, and how can we do the work to decolonize mental health and access to services for mental health?
Yeah. I'd like to begin by saying that stigma still exists in our community because there's a historic connection to it. Our medicine people historically were removed from our communities and put in mental institutions. And these stories are live stories in families and in communities. So, and the systems have not been good with us. A lot of systems, whether it's the health system, whether it's the legal system, there's a lack of distrust because we have that historic experience. I think that's one of the reasons. I think the other thing that we really need that would be helpful is building community. And what I mean by building community is having funding so we can have peer support, we can have support with, as I said earlier, like have a drop-in center, have groups, funding for groups where it's a funding that it's like a pre-treatment. It gets people to go to the door to get into treatment. If people can feel safe in an atmosphere where you're located, in other words, if people can come to where you're at and they see people like them, they understand, they hear experiences, people can share experiences that they've had, staff can share experiences and how they've transcended things. I think that's very important for the community to understand, because oftentimes there's this power dynamic between staff and people that are working and people that are from the community, and maybe survival is their first basic need, right? They have to survive, so they're going to be concentrating on survival more than they are trying to get into mental health. And one of the ways that our communities survive is they call each other, the moccasin telegraph. They have communication with each other. Or in our agency now, one of the ladies has begun a woman's singing group. And that singing group was so successful in bringing people in. They learn traditional songs, they're able to sing, and they feel a part of. And so when you have people from your community that feel a part of, then they can start reaching out, or there's a bridge that's made between clinicians and healers and helpers. I think the language we use also is very important. I'd like to see the name mental health be replaced by behavioral health, because the word mental has a stigma. I heard it as a child. I heard it. My mother, she always talked about, I don't need a psychiatrist. Of course, nobody needs a psychiatrist. What we need to get into balance. When we have a mental health challenge or we have survival challenges, we're out of balance. If we're worrying about where we're going to get our next meal, where we're going to live, then that's produced. These are stressors, community environmental stressors. So I think building a place where people feel safe and having staff that can interact at community events, at groups, not have people come like when they're there, spend time with the community. Spend time with the community so the community gets to know your face and can laugh with you. It's about building relationships. I learned that when I first got in this field, and it's about if we don't build relationships with the community, they're not going to come. Build a place for them, and they will come. So I'll stop with that.
Thank you, Michelle. Danielle.
Yeah, so demystifying mental health, I think we need credible messengers, right? So a lot of times it's folks that look like you, sound like you, maybe have similar cultural experiences. I always believe we all participate in the same culture as Latinx, but we all have different experiences in it, right? So if you're queer Latinx, you're going to have a different experience than if you're hetero male Latinx person, right? If you're a U.S. citizen versus immigrant. So we all participate in this culture, but we might have different experiences. So we need to have a vast array of therapists and healers that can meet the needs. And so a couple of examples of some organizations I really like is there's a Therapy for Latinx, that's a directory. And then beyond the Latinx community, there's a site called inclusivetherapist.com. And that's a directory of any therapist, but they do self-identify as inclusive and identity affirming. So there are things that are starting to happen that really put credible messengers in front of those communities. But I also believe you cannot be within the Latinx community and still be a culturally affirming therapist. So that's why I like the Inclusive Therapist site. But also we need to talk about it, like not when we're in a crisis, when we're not in a crisis, and talk about it around those times. And so that's what a lot of times what we do on our podcast is just Platica style. Let's talk about mental health. Let's just, when we're not in a crisis and we can focus, we also ask people for their input, or, we also take people's experiences and meet them where they're at with their narrative. So we try not to have these mental health boxes, right? It's like, well, what's going on for you? What's your specific thing? And I was right in front of this myself in terms of watching how my family dealt with this, because unfortunately in 2019, my abuelitos were in the Walmart in El Paso during the mass shooting. My abuelito was shot and he did pass away. My abuelita witnessed it. She did survive in her arm. She had a major arm injury. And so my family was just rocked by this. And clearly there was trauma, active trauma, like immediately and still to this day. So so it's like, how did my family get through this? And a lot of my family, they were listening to the doctors. They were listening to afterwards, my abuelita has a lot of physical therapy, and they were more inclined to listen to the doctors and the therapist showing her how to move her arm again and all that. But when it came to the trauma and the mental health part of it, they were like, I don't want to talk to anybody. So they would accept all the other services, but they wouldn't accept the therapist. They brought a therapist out of retirement who was Latina, lived in the neighborhood, had been a part of El Paso for a long time. And they actually were able to get my grandmother someone to talk to. And she would just come over, platica style, and just talk. When I say platica, it means like chat, just like, chat. So nothing formal. She wasn't talked at. She wasn't given psychoeducation, formally. And there was not a bunch of paperwork. It was just her sitting on the couch with my abuelita and letting my abuelita cry and recall things. And that was, but we really never said mental health access or counseling. We just said, ¿quieres hablar con una mujer, una consejera? And, do you want to just talk to this lady? And, just kind of make it less formal. Because again, those formal systems, she's never served by them. That's not going to be her buy-in. And so that's kind of what we had to do to demystify, is like ask her in a different way on her level, and then have someone come in. And they had to get creative. They had to bring someone out of retirement, but the hospital where she was served did a very good job. In the evening, when we were in the emergency room in the ICU, they brought out café and pan dulce for everybody. And it was just so warming, and it was so familiar. The majority of the family shot were Latinx. So it just something about that was like, we didn't have to think. You didn't get us like Burger King, Chick-fil-A or something, because food is another topic, but in the Latinx community, like my abuelita will only eat Latinx food and certain ingredients that she does not eat, like fast food and things. So if they would have brought a bunch of packets of cheese crackers or something, it's just like they really knew who we were. They really knew what we needed at that time. And we didn't have to think about it, which I think that's liberation right there, right? So you get us. We don't even have to ask for this. You brought it out for us. So I think there's a lot of ways that we can demystify. We will have to get creative, but that's the point. We don't want to use typical Western styles because this just doesn't work for us. It never had, and it never brought in our perspective and what we want.
Thank you for sharing, Danielle. This reminds me of part of a conversation that we had when we conducted our listening sessions in Kern County, and the Indigenous participants shared, no one talks about mental health. We don't, if you want, you can maybe use the term emotional well-being, but really what it comes down to is we ask people, how is your heart doing? How is your heart? And that's how you check in with people. And that's how you start these conversations around emotional well-being and mental health. It's not always, we have to use language that's more accessible and follow the example of those most impacted. I know we're coming up on time. We have a couple of minutes left. Thank you for sharing those strategies that have worked within your community. I do want to have you both share something that you are hopeful for and that you wish for as we create new ways of healing for our communities.
Okay, I'm happy to start. I'm hopeful for finding balance in our community, and I'm hopeful that insurances and funders will see the importance of finding balance, for creating spaces for finding balance. And I want to also piggyback off Danielle with the food. I mean, healthy food. Our elders don't want to eat junk food or things that you can't read the label on. And oftentimes, traditionally, we always fed people when they come. So I'm hopeful that, that we can create these spaces where they can be welcoming for our people and healing for our people at the same time, doing arts and crafts. And just as Danielle said, having a space where you can just talk. I had a client that told me when I was early in my therapist years, he said to me one time, he said, "Michelle, would you take off the white coat?" And I really had to look at myself and how I was doing therapy. And that was the beginning of a transformation for me to integrate traditional healing method using songs and stories and traditional ways of thinking of things with clients. That has been very helpful. And I think that I'm hopeful that we'll have more people be able to begin to do that with their clients and learn to understand. I think the big one of the big challenges people have is when we do these things, how do we put it in billable terms? But all of these things create balance. There's psychoeducation in these. There's an understanding of how people got to the place they're at, understanding of tools to use to help them in their journey, and understanding from a spiritual perspective how they can use spirituality as their strength and our traditional ways as their strength. So I'm hopeful that that insurances will understand that that's a primary necessity for healing, and that our agencies will find a way to incorporate that and to help staff to be able to write or document the services as a healing modality, because our healing methods are very, that some of them may have not gone through evidence-based practice, but they're practice-based evidence, and we know this for tens of thousands of years. We know this. Yeah. In the interest of time, I'm going to stop there.
I know I'm going to follow up after this. Danielle, something that you're hopeful for, that you wish for?
Yeah, I just feel like we need to acknowledge the fact that we have human bodies and that they will do what they do whether or not we have insurance. So we need to figure out how to get mental health access to people with or without insurance. That should not be a reason you're not getting treatment. And that is also for the purpose of keeping our communities going. When I work with people with severe mental health needs, they're not working. So if we want to keep this country going and working, because we're not going to solve or address capitalism anytime soon. So we are in that society. We want people to work. We've got to get them help with or without insurance. So we need to do that. Then I do hope that we really value and center all communities of color. We have all been practicing wellness this whole time. It's just been our own ways. And one example before we go is dichos. Dichos are like sayings. That is in the Latinx community, right? When I translate that out to like Western style, that's actually a cognitive skill. It's a cognitive reminder. That's what that is. It's a real skill. We do teach it to all clients, but we actually have it embedded in our culture, and we have tons of them that have been passed down through generations. So sometimes it's like, yeah, we don't need to put a sticky on the mirror that says breathe. We got a dicho that has been passed down through our family that helps us get through today, which is powerful. So we need to really center people of color and how we have been providing each other and ourselves wellness practices. And thank you so much for letting me be in this space. And it was nice to be here with both of you. And thank you for all the comments. I've been reading them.
Yes. Keep your comments and questions going. I know there'll be follow-up. Thank you so much to both of you, Danielle and Michelle, for giving us your experiences and your insights. For our next panel, we will be moving to the orange stage to announce the zine winners and learning about the listening sessions from a multicultural lens. So to navigate to the new stage, on the left-hand side of your screen, you click stages and then make sure to select the orange stage. Thank you so much to everyone. We'll see you at the next session.
Okay, great. Thank you. Thank you.
Thank you.